A new COVID-19 variant, called Nimbus, has emerged and is raising global concern. Infection rates are climbing as summer approaches, with many regions seeing an uptick in cases. Scientists are learning more about Nimbus every day, but initial reports suggest it spreads easily. This could mean a potential summer wave, impacting healthcare systems and disrupting plans. Preparation and awareness are crucial as the pandemic continues to evolve. Staying informed is key to our response. This video will break down what we know about Nimbus, its origins, why experts are worried, and what you need to know. Understanding the variant helps us act wisely and reduces fear. The emergence of Nimbus is a reminder. The virus is still with us and continues to adapt. Our response must adapt as well. Complacency is a risk we can't afford. The knowledge gained over the past years should guide our actions now. This new variant demands our focus. Let's dive into what we know so far. Scientists are tracking the spread and characteristics of Nimbus closely. Early data shows it's more transmissible than previous variants. The situation is changing quickly, so staying updated is essential. We'll cover the latest facts and what they mean for you. The virus's ability to change is why we must remain vigilant. Our collective efforts can make a difference. Let's work together to stay safe. The story of Nimbus is still unfolding. We'll help you understand what matters most. Knowledge is our best tool. Stay tuned as we explore the details. Here's what you need to know about Nimbus. Nimbus, officially named NB1. 8.1, is a descendant of Omicron. Like Omicron, it carries several mutations, but Nimbus has new changes that set it apart. Scientists are focused on these mutations because they can affect how the virus spreads and how our immune systems respond. Early evidence suggests Nimbus is highly contagious, possibly more so than previous strains. Another concern is that Nimbus may be better at evading immunity from vaccines or past infections. Nimbus follows Omicron's pattern of rapid spread, but its specific differences are under close study. The genetic makeup of Nimbus is being sequenced to track its evolution and mutations. Changes in the spike protein can impact how well vaccines work. Research is ongoing and new findings are emerging daily. The virus's evolution highlights the need for continued vigilance. Staying informed helps us prepare for what's next. Together, we can respond effectively to Nimbus. Nimbus first surged in Asia, with countries like China, Singapore, and Hong Kong reporting rising cases. Early warnings alerted global health authorities. International travel quickly spread Nimbus worldwide. Now, Nimbus makes up over 10% of global COVID infections. The World Health Organization designated Nimbus a variant under monitoring in May 2025. WHO is tracking it closely and gathering data worldwide. Even highly vaccinated areas are watching Nimbus's spread. Our interconnected world means a variant can quickly become a global issue. International cooperation is essential to manage the spread. The situation is evolving rapidly. Health agencies are working together to track and contain Nimbus. The fight against COVID is far from over. Let's work together to meet this new challenge. In the UK, concerns are mounting as COVID cases rise sharply. As of June 1st, over 6% of people tested for COVID were positive, the highest rate this year. This marks a clear upward trend and signals increased community transmission. The positivity rate has nearly doubled since early March, showing how quickly things can change. Week on week, cases continue to climb. Professor Lawrence Young, a virologist, warns that the summer months could see further increases. Officially, only a handful of Nimbus cases have been confirmed in England, but the real number is likely higher. Reduced testing means many infections go unreported, especially mild cases. This makes tracking the variant more difficult. UK health authorities are relying on multiple data sources to monitor the situation. The drop in testing is a significant challenge for accurate surveillance. Many people with mild symptoms may not get tested, leading to underestimation. Genomic sequencing has identified at least 13 cases, but this is likely just the tip of the iceberg. 25 British samples have been submitted to international databases since late March. The true scale of Nimbus's spread is uncertain. Authorities are urging caution and close monitoring. The rapid rise in cases is a reminder to stay vigilant. The situation can change quickly, especially with new variants. Public health agencies are adapting their strategies. Accurate data is essential for effective response. The UK is not alone. Other countries face similar challenges. Ongoing surveillance will be key in the coming weeks. Staying informed helps everyone make better decisions. The fight against COVID continues. Nimbus symptoms are similar to other COVID variants, especially Omicron. Common signs include fatigue, fever, muscle aches, and a sore throat, often more severe than a typical cold. A mild cough and congestion are also reported. Recognizing these symptoms early is important, especially if COVID is spreading in your area. Early detection allows for timely precautions and helps prevent further spread. There's no strong evidence that Nimbus causes more severe illness or higher death rates than previous strains. However, any COVID infection can be risky, especially for vulnerable groups. Hospitalizations have risen in some countries where Nimbus is widespread, even if the variant itself isn't more severe. A highly transmissible variant can still lead to more hospitalizations, simply due to the sheer number of cases. Vulnerable individuals remain at higher risk. COVID was still a factor in over 300 deaths in England in May 2025. Monitoring symptoms and acting quickly remains crucial. Stay alert to changes in your health. Early action can protect you and those around you. Certain groups remain most at risk from Nimbus, as with previous COVID variants. Older adults, especially those over 75, are particularly vulnerable. Residents of care homes and people with weakened immune systems also face higher risks. Waning immunity from vaccines or past infections can increase susceptibility. Chronic illnesses and immune compromise make infections more dangerous. Protecting these groups is a top priority. In May 2025, COVID contributed to over 300 deaths in England, underscoring the ongoing threat. Our actions can help shield the most vulnerable. Staying vigilant and following protective measures is essential. Vaccination and boosters are especially important for these groups. Collective efforts make a real difference. The threat is real for those at higher risk. Ongoing awareness and care are needed. Let's protect those who need it most. Their health depends on our shared responsibility. Current COVID vaccines, especially those updated for Omicron, are expected to protect against Nimbus. Vaccination reduces the risk of severe illness, hospitalization, and death. Booster doses are crucial as immunity can wane over time. Boosters refresh your protection and strengthen your immune response. Data from the UKHSA shows boosted individuals are significantly less likely to need hospital care. This protection likely extends to Nimbus. In the UK, free vaccines are available for the most vulnerable, including older adults and those with weakened immune systems. Health authorities urge eligible people to get vaccinated. Vaccination is the best way to protect yourself and your community. Boosters make a real difference. Stay up to date with your shots. Protect yourself and those around you. Health experts warn of a possible summer spike in COVID cases, driven by Nimbus. Waning immunity and increased social gatherings could fuel the rise. COVID can spread even in hot, humid weather, especially at crowded events. If you have symptoms, stay home and avoid contact with others, especially the vulnerable. If you must go out, wear a well-fitting mask and take precautions. Avoid crowded or poorly ventilated indoor spaces. Practice good respiratory hygiene. Cover coughs, wash hands frequently, and use hand sanitizer. These simple steps help reduce the spread of Nimbus and other respiratory illnesses. Public health advice remains consistent. Follow it to protect yourself and others. The UKASA is monitoring the situation closely. Stay alert to new guidance as the situation evolves. Small actions can have a big impact. Let's keep our communities safe this summer. Together we can limit the spread. We all play a part in protecting ourselves and our communities from Nimbus. Following health advice and staying informed is essential. Listen to reliable sources and keep up with the latest updates. If you're eligible, get vaccinated or boosted. Practice recommended safety measures. Stay home if unwell, wear a mask in crowded places, and maintain good hand hygiene. Ventilate indoor spaces whenever possible. These actions remain our first line of defense. Approach the summer with caution and preparedness. We've learned a lot about managing COVID. Let's use that knowledge now. Nimbus is a new challenge, but we're not starting from scratch. By working together, we can protect the vulnerable and minimize disruption. Your efforts matter. Let's make this summer safer for everyone. Stay vigilant, stay informed, and support each other. Together,